Hello. Right, let's check that you could actually hear me. Hi, welcome to another stream. It's so good of you to be with me tonight. I'm looking at my phone because I want to check that I'm actually audible with these headsets on. So just give me a second, guys. Hello. Yes, I am. Let's check that you could Amazing. So, hello, welcome. Thank you so much for joining me. It's great to have you here. Thank you so much for being part of my Sunday evening. And perhaps we're meeting for the very first time. My name is Dr. Sylvia. I'm a general practitioner, family doctor. I'm based in the United Kingdom. And of course, we are AskAwayHealth. Our channel is dedicated to providing health information for everyone, but particularly if you're interested in women's health, sexual health, and especially if you're like me, a Black woman or woman of color, Asian, other non-Caucasian woman who's interested in how health issues could affect us specifically. But everybody is welcome, absolutely. I just find that it is good to have representation, and I think that it's important that I'm able to present information, health information for women who look like me, who have bodies similar to me, and so on. But I hope you've been well since the last time that that I saw you on a live stream. It has been a couple of weeks, but even though I've not been able to go live, I have been able to publish some videos. So hopefully you have been catching up with them. It's been quite interesting few days. Of course, October is the Black History Month, and there's been a lot going on online, just raising awareness about different issues to do with Black history. But also, it's been Menopause Awareness Month, and I did promise I was going to dedicate several of the videos on the channel simply to the topic of menopause and perimenopause. So I hope that you have caught up with the videos I've shared recently. Let me just share my screen. And just remind you of the videos that we've had on AskAwayHealth. Just bear with me a second. So it should be showing here because I haven't closed it off. So not that one, not that one. Okay, for some reason it is not showing. Oh, I know why. It should be showing. Okay. Okay. So now, for some reason, I'm not able to share that screen. Anyway, go to my YouTube channel. Go to my YouTube channel. The last couple of videos have been about perimenopause and menopause. Hang on a second. I'm getting some kind of funny echo. I don't know why. Oh, these are the tech gremlins. Let's blame the tech gremlins for this interruption. Or then it might be the speaker as well, because this is my first time using it on the live, so maybe it's doing something odd. Let me know either in the comments or on replay if you're having problems with sound. But I was just going to share with you that I have published a few videos on perimenopause. You know what? Let me just stop this. Okay, so hopefully the sound should be fine. Hi, welcome to another stream. It's so good of you to be with me tonight. Okay, I think it's better. I think it's better, but yes, let me know if anything seems wonky, please. Anybody who's watching live or who's watching on the replay, yeah, I think it's something. Okay, sorry for that little glitch in transmission. We're here because we want to talk about HRT, and I really want to talk about HRT content because we know much about HRT. It brings up lots of questions. Its history in terms of the when the drug HRT was first developed, and the different studies didn't really help because it created the mindset that there were problems with the medication. But the longer that we've been able to explore studies, um, following from people who've used HRT, we've got a better understanding of how it works. We've got a better understanding of its benefits and its risks. And I want to address them particularly today. I was hoping to, oh, the other thing I was going to say as well was, especially if this is the first time you're coming onto the channel, I promise it'll be a lot more organized than this. But I also run the AskAwayHealth.org platform, which I think I should be able to share the screen because I saw it a few minutes ago. Um, so what you're looking at now is the AskAwayHealth website, and it is here for conversation, here for questions. And if you have questions related to your health, you want to find out something that's, you're not settled about and you can't really get the answer anywhere else, please come and use this platform. Click Ask a Question here, and you get transfer information service from anywhere in the world, and we'll look at your specific inquiry and hopefully be able to provide you some support, some direction, depending on what it is that you're asking about. So I wanted to mention that before we get too far into things. Um, and of course, I've got a poll running. So if you're watching live, I would really appreciate it if you could pop into the poll and tell me what you think. The question is, what's your biggest concern when considering HRT? I think I know where the extra sound was coming from now. It was coming from my other window. I had my video open on another window on the same computer, so that's what was happening. Anyway, so what's your biggest concern when considering HRT? I would love to hear from you. Please vote in the poll. I think it's important that as our community grows and evolves, let us hear what is it that you're particularly concerned about when it comes to HRT. I'd love to hear from you, so please share your thoughts in response to that poll. I think somebody's already responded, but the different options are risks of side effects, access to information about HRT, is it HRT alternatives, or is it the query with their effectiveness in managing your symptoms? So those are the four options. What's your biggest concern when considering HRT? Right, so we're going to get into tonight's topic. I'm just going to take a quick break, make sure all that my different slides and things are working properly. Don't go away. I'll be back with you just in a moment. Oh my goodness, if I tell you the issues I'm having with technology tonight, I don't understand. Anyway, let us begin. We're talking about HRT. I thought that before we start having this conversation, I'd like to share a little bit of my own personal journey when it comes to issues about HRT. It's a personal decision. There's a lot of sound going on at the moment when it comes to HRT, whether we should use HRT, what about the safety issues with HRT, and so on. But I think it's a very personal decision for every single woman. You can't follow the crowd. You have to consider your own specific situation and then have a conversation with your own doctor. So I found myself in this same situation that many women will find themselves with, developing symptoms that we put down to menopause or perimenopause. And just for the sake of definition, menopause is when a woman has come to the end of her childbearing years. It is usually indicated by not having periods for 12 consecutive months. So when you have not had your periods for 12 consecutive months, you have reached menopause. The period before that, when that transition begins, where many women may experience different symptoms to different degrees, that period is known as the perimenopause. So you may still have periods during that time, or they might start becoming irregular. There may be different changes. I would like to say that many women don't experience anything, and that doesn't mean they're not going through perimenopause, because they will come to a point where they stop their childbearing years. But it is some women who experience symptoms, and those are the women that issues around HRT, the whole conversation around perimenopause and menopause are directed towards. But coming to myself, so I experienced things like feeling very, very tired, the kind of tiredness that you cannot attribute to something else. I experienced trouble sleeping, so not being able to get to sleep, just whether you want to call it a mental busyness or something that just prevented restful sleep. But in addition to that, we're also night sweats, really, really draining, really, what's the best word to describe it? And this is common. You may not be able to find the words to describe clearly what you mean, but I'm trying to describe quite pervasive sweating that's so uncomfortable. Yeah, it can happen during the night, but of course, hot flushes during the daytime, and then issues with weight. I think those are sort of the main things that happened when I started thinking about perimenopause and asking myself about the HRT question as it related to me as a person. And the decision to use HRT wasn't something I would take very lightly, and mainly because of my family history. I come from a background where I have a close family member, my mom, who suffered from breast cancer. There is a history of heart disease in the family as well. So there were concerns that I had, and again, when I speak to women who share the same issues, I sort of look at my own experience and use that to relate to them about how to go on in their own journey. So I was also, even with my background, because there is so much information out there and you want to find the information that is best suited to yourself. So I would also sit down, look through the information available, and then come and speak to my doctor and say, well, what are the current best ways to approach these symptoms. So, bearing that in mind, heart disease, breast cancer, those were big concerns around HRT. And we're going to talk about this in a little bit, in a few minutes as we carry on the conversation. But I just wanted to share that I have also personally experienced that disquiet, that uncertainty, and it is in looking at the information available. It is in having conversation with, people that are looking after us in the position of our, health providers that can help us to go forward and make the right decision. The other thing I forgot to add was that for some time, I was also using the hormonal birth control coil. And so I wasn't unfamiliar with hormones in my system. And I also wanted to ask the question about possible effects, even though it was quite a few years since I'd stopped using any form of birth control before I decided to go on to HRT. And then, of course, the other issue was weight, because I'd noticed the increasing challenge as I got into perimenopause with keeping weight off. I've got a large frame where, we've got large frames in my body, in my family. So I've come from that sort of background where we're not naturally skinny or slim people, where some of us, but not too many of us are. But I noticed that it was more and more difficult as I got into perimenopause. And this is something that we all, or many of us who are experiencing perimenopause, those are some of the challenges that we will experience. So that's mine. I don't know what yours was, or what yours has been, or what you're concerned about, or what you even know could potentially be your experience as you get into that age, because I'm speaking to a diverse group of women of different ages. Some of you might already be in perimenopause. Some of you might have already experienced menopause. Some might just, be approaching it, or, just interested in having the conversation. I want us to take away with, and I'm not afraid to say it at the very beginning, because I think it's, if that's just one thing you take away before you click away from this video, is that it's a tailored approach. The solution to any perimenopause or menopause issues, if you have them, has to be a tailored approach. Don't follow the crowd, okay? And again, we need to talk about context, and you see where context comes into things. But starting HRT early is better than starting it late. If you take anything, that's the second thing that you should take away. If you take anything away from this video. And so let us go on now to have a look at the benefits of HRT. I'm going to take a quick break, but let us start thinking about the benefits of HRT. And again, because we don't talk about it too much, I wanted to start off with that just for a couple of minutes before we go into what I know many people will be interested in, the risks. So let's first of all look at the benefits, but give me a second, I should be back with you.
Hi, I'm Dr. Sylvia. I'm so excited you're here. In this video, you'll get excellent health tips that will make a real difference. But that's not all. I also create personalized guides, tools, and plans tailored to your specific needs. These resources will help you reach your goals faster and more effectively. Don't miss out on your free copies. Check out the links in the description box below. Before you watch this video, please like and subscribe to the channel so we can continue this health journey together. So, let's get started. I'll see you in the rest of the video. Hi, I'm Dr.
Okay, all right. So, benefits of HRT. So, HRT, hormone replacement therapy. Some other areas, menopause replacement therapy or treatment. Menopause hormone replacement treatment or menopause hormone replacement, different terms that we use, but commonly known as HRT, is usually given to a woman who is experiencing perimenopause or menopausal symptoms. The first thing to say is that not every single woman is going to experience distressing symptoms because they're going through menopause or perimenopause, but some women do. And among the women who do, the degree of experience is different. It varies from one woman to the next. There is a whole list of so many different symptoms that could happen during perimenopause. And you may not experience all of them. You may experience a few, you may not experience all of them. So again, I have to emphasize the importance of a tailored individual approach in terms of treating menopause. But the reason that you will be prescribed HRT, and it is a prescription drug, it's not something you can get over the counter. The reason that you'll be prescribed HRT is either because you're experiencing menopause symptoms, but there's another use for HRT. It's used for women who are experiencing thinning of their bones. So it's directed to those women who have a condition known as osteoporosis, which, like I said, is bone thinning. The bone strength has dropped. The bones are not as dense as before, because if they do not have something to help to treat or maintain their bone strength, they can be at risk of experiencing fractures very easily, which can come with a whole host of complications. So we don't talk too much about that side of HRT use, but those are the two primary reasons that you would have HRT. But what are the benefits of HRT? And I'm going to now stick to menopause stroke perimenopause. Hormone replacement therapy is good, is effective for treating symptoms that happen during menopause. We're talking about night sweats, hot flashes, in particular, those symptoms, the hot sweats, hot flushes, night sweats, in particular those symptoms. But it can also be quite useful for changes to the mood, because some of us would experience low mood or even mood swings. So it could be effective in that group of women. And to some extent, it might also help for things like tiredness. But the most effective use for HRT comes or the greatest benefit comes for women who experience hot flushes and night sweats. Of course, it's also useful for vaginal dryness, which itself is one of the symptoms of perimenopause or menopause. And using vaginal estrogen, which is a type of HRT, is also extremely effective if things like vaginal moisturizers have not worked. Okay, so those symptoms, which can be very distressing, can be very bothersome for some women, can be effectively treated. And the most effective, I would say, are the night sweats, the hot flushes, can be good for mood swings or mood changes, and vaginal dryness. Now, it can also help with a range of other different symptoms that come along with menopause or perimenopause, but I've just brought out those ones as the ones that are sort of top of the list. For the majority of women, and for which HRT is particularly good at. There could be other conditions that HRT may not necessarily touch, and which, you might need a different type or an additional type of treatment to cover those specific symptoms. And then the other thing as well is that as HRT improves night sweats, hot flushes, as it improves the vaginal dryness problem, your well-being improves. So that's another benefit that you would gain from using HRT if it is prescribed to you for menopausal or perimenopausal symptoms. And I don't really want to spend too much time on talking about bones, but I also wanted to put it in as an important reason that we use. Another benefit that you get from using HRT is that it will help to maintain bone strength. Not everybody has to be on HRT. It is not mandatory for every woman going through the menopause. And I keep saying this because, we're talking about it so much that people will be asking, oh, right, should we all now get prescribed HRT? No, that's not the point we're trying to make. I'm saying that in the situation where a woman needs to have HRT prescribed, then these are the benefits that you can expect from using HRT. Other benefits are on the effect on the heart and the blood vessels, so the cardiovascular system. And people might be surprised, but again, I'm already discussing context now. Because when the initial studies came out about HRT, when the drugs were being tested, when we started initial trials decades ago, the worry was that it increased the risk of heart problems, heart attacks, strokes, and so on. But context, because we've had the chance to look at the data properly over the last 5, 6, 7 years, and we've come to realize that there's actually a reduced effect, or there's actually less risk of heart disease when HRT is started very early on after menopause sets in. So you're more likely to experience any of those cardiovascular side effects like heart attacks or strokes if you're using HRT at very advanced age. So we're talking about over the age of 60, 65 onwards. But the thing is, you're also more likely to experience those conditions at that age. So there is compounding effect. I think that's the best way to put it. So what am I saying? If a woman is starting HRT in her late 40s or 50s, there is no need to worry that it increases your risk of a heart attack or stroke at that age. Okay, so the studies that we've looked at actually indicate that there is a less risk of a heart attack or stroke, but that risk when you're in your between the ages of 50 to 60, so under the age of 60, but that risk will go up as women grow older, go past the age of 60 into their into the decades between 60, 70 and upwards. So that's an additional benefit it might surprise some people to realize that actually being on HRT, that is, if you need to have it, could have a protective effect on your heart and your blood vessels, but it is age related. It's age related. Context again. The other additional benefit that you would experience, similar to what I've been saying about the heart, is with dementia or Alzheimer's dementia, to be specific, which is where there is impairment in memory and thinking. Actually using estrogen or HRT early on, and again within that late 40s or 50s, because commonly we reach menopause around the age of 50, 51, maybe a little bit earlier in Black women, but commonly around that age of the late 40s, early 50s, up to the age of 60. If you're starting HRT earlier, what we've noticed is that there is a reduced risk of developing Alzheimer's disease. Now, this does not mean that we're saying that HRT is used to treat or prevent Alzheimer's dementia. No, it's not even used to treat or prevent heart disease. No, I was very careful to say at the beginning that there are two main reasons why we will give HRT. That's to deal with perimenopausal menopausal symptoms is the first, and the second one is to do with osteoporosis and thinning bones. Nothing to do, it's not prescribed to anyone because you want to reduce their risk of heart disease. What we're saying is that in the instance that you're taking it for either of those conditions, the additional benefits that you gain between a particular age or within a particular age range is that there is a reduced risk of heart disease, a reduced risk of developing dementia. There are also other benefits that studies have demonstrated to us. One of them is reducing the risk of bowel cancer. Another benefit is also the reduced risk of developing type 2 diabetes. So why have I brought this up? I think it's important to say this because for those of us who use HRT, understanding the drug is important, of course, understanding how it works, but also understanding what science tells us that it has demonstrated benefits for some women in terms of taking the medication. I'm going to talk about the risks in a minute. I'm just trying to see if there's any kind of if there are any of the benefits I've missed that I wanted to talk about that I've missed out on. No. Okay. Thank you so much for watching. Thank you so much for joining. Hi, Michelle. I'm not sure what you're saying here, so please send the message again to me if it's something I need to pick up from, if I need to pick up with. Hi, Simone. Thank you so much for joining. Simone says, does it help with indigestion? I'm struggling. So, good question. Okay. I would say the first thing I would want to know is what's causing your indigestion. Okay. Because it's very important. And I wish I said that at the beginning, but I thank you for reminding me. It's very important to make sure that the symptoms that we're describing as possibly menopause are not as a result of something else. So first thing is to check what is responsible for your indigestion. I wouldn't just give HRT because of indigestion without being clear in my mind that it's not caused by anything else. It's nothing to do with acid reflux disease, for example. And depending on your age, I'll be very interested. So, for example, if you're over 50 or over late 40s, 50s upwards, I just want to make sure that indigestion is not coming along with other symptoms that might suggest something else that is more worrying, more bowel-related problems, other types of bowel disease, even bowel cancer. So I would expect that you speak to your doctor about this. But in the instance that you have checked and, whatever test or whatever history and examination, all that is done, and we're quite clear that you're experiencing these changes as a result of menopause, because yes, you can have bowel changes, bowel disturbances, like indigestion in menopause or perimenopause, then yes, you can get some relief by using HRT. How well will it be effective? I don't know. It depends on one individual to another. It's something that we cannot say specifically it would help with HRT until you try to see if it would help with your own symptoms. But since we know that these hormones can affect our bowel movements, of course, it can affect so many different organs in the body. It's not just estrogen and progesterone are not just about the ovaries. They're not just about the menstrual period. They're not just about, protecting or helping to develop pregnancy. They have an effect all over the body, on the brain, on the bones, even on the gut as well. So I do think it is a good idea. Once you've had your check, once there's nothing else going on, no abnormalities in terms of acid reflux or any other bowel-related condition, I think it's something that you can have a conversation with your doctor and say, is it worthwhile considering HRT because I'm having all these other symptoms. So Simone comes back to say 45 and do have a few symptoms. So I think it's worthwhile having that discussion with your doctor. If these other symptoms that you have are related to perimenopause and they're tying them all together, they're making sure that you've had tests, you've had examination or scans, that is not as a result of anything else. If you've tried treatment, for example, for acid reflux, and it's not worked, then it's a conversation to have with your doctor. Don't forget that they should look at making sure that you're suitable, that HRT is suitable for you as well, because it's not suitable for everybody, either depending on your medical background and, so on. Those are things that you have conversation with your doctor about. Excuse me. Headaches, heart palpitations, frozen shoulders, joint pains, extreme fatigue, just to name a few. Yeah. So the thing about menopause and perimenopause, if you go through all the different symptoms, there is none that is so unique to any single one condition. And that is why yes, if you come, even if you're in your early 50s and you came and said, oh, I'm having all these symptoms, it sounds like menopause, the appropriate thing to do is to check that none of them is related to any other condition. And then we can look at the possibility of menopause and perimenopause. And it's not going to take a long time to try and work out that it's not because of this or that or the other. No, it should be part of a clinical consultation that shouldn't be delayed into weeks or months before we try and get the answer. No, so there shouldn't be any delay. But I think the process should be have a chat with your doctor, go through all the different symptoms you're experiencing. They should do an examination, consider any tests they want to do, give all those other possible causes all clear first, and then have that conversation about perimenopause and menopause and the possibility of HRT. And yes, it is possible that there could be some effect in terms of taking HRT to manage those indigestion and even some of these other symptoms that you've mentioned. I think it's worth it, but let us be careful. Let us go about it the right way. And yeah, Simone, you're absolutely welcome. Thank you so much for joining in, and I really appreciate that question. It helped me to touch a few things I've not mentioned. Okay, so we've talked about benefits of HRT, and I've mentioned the things to put in context, and we're going to go now into the risks of HRT. And please feel free to pop any questions you have in the comment section, like Simone, very much welcome. And then we can look at as many of them as possible. The one thing I didn't do, and that was because of my tech glitch at the beginning, the one thing I didn't do was to add a disclaimer here. I always put it here because it's so important to say that we're here trying to provide education, not to provide any specific treatment. So I can only provide general guidance and not treat you specifically because, of course, I don't have a medical background or medical history. So please bear that in mind. But it's good for us to have conversation. It's good for us to, sort of know where to look, what to say, and how to say it to our doctors. And that's why I'm, happy to share information. Okay, so give me just 1 second, and then we'll get on to the risks of HRT.
Hi, I'm Dr. Sylvia. I'm so excited you're here. In this video, you'll get excellent health tips that will make a real difference. But that's not all. I also create personalized guides, tools, and plans tailored to your specific health needs. These resources will help you reach your goals faster and more effectively. So don't miss out on your free copies. Check out the links in the description box below. Before you go on to watch the video, please like and subscribe.
Okay, here we are back again. So we're looking at HRT benefits, risks, and looking at them in context so that we will appreciate what the drugs are for. We will understand how best to use them and how they can benefit us or how they could put us at risk, and how to make a judgment about whether they are right for us or not. So a few of the most common risks that we know when it comes to using HRT. Of course, anybody you ask will first talk to you about breast cancer. So there's breast cancer, there is developing blood clots or deep vein thrombosis or DVT or PE, pulmonary embolism, as some of you might know. Then the risk of heart disease, which I'd mentioned earlier. The risk of womb cancer. So let's just put them in context very quickly. I'm going to spend a chunk of time really on breast cancer. And of course, if there are any questions, I can also sort of deviate into those as well. The risk of womb cancer. Now, this is usually when it is the type of HRT that is given without, that is estrogen is given without a progesterone to a woman who has her womb, who still has her womb. And I say still has her womb because for many different reasons, some women don't have their womb, they've had a hysterectomy or, whatever the case may be. And so we have different types of estrogen, HRT, I beg your pardon. You have the combined HRT, which contains a combination of the progesterone and estrogen. And then you have the estrogen-only HRT. The instance where womb cancer is most likely to develop is when a woman who still has her womb is given the estrogen-only method. That is to take systemically by mouth, or she's only giving estrogen without the accompanying protection of progesterone while she still has her womb. The problem being that the womb tissue is just going to keep growing and growing and growing because of the estrogen. Usually, you should have a progesterone to interrupt that growth. So womb cancer, we're talking about context. So when you hear, oh, HRT, it can cause womb cancer, it is in instances where a woman who has her womb is given only estrogen. So of course, that is one thing that your doctor will not do. And that is one of the reasons when we're looking at your suitable, if you're suitable for HRT, and then we're asking different questions. One of the questions that determines which type of HRT you're going to have is, have you still got your womb? Because if you have, automatically, you qualify to have the combined type of HRT. You have to have HRT that's got estrogen and progesterone. Just to digress a little bit, because in case it comes up, in case I forget to say it. So if you're in that category of a woman who still has her womb, then the question becomes, are you in the perimenopause phase where perhaps you're still seeing periods? They might still be regular, or they might have started getting irregular. Or are you in the phase where you've actually stopped having your periods, but you still need to have HRT? And the reason why that question is relevant is because if you're in the latter stage, that is somebody who stopped seeing her period, then you would have the continuous combined HRT where you have estrogen and progesterone throughout the cycle, no breaks, estrogen and progesterone throughout your cycle, as long as you have the HRT. Different from the person who is still having periods and who gets something called the cyclical HRT. The cyclical meaning that they have estrogen for the whole of the cycle or the whole of the month, and then progesterone for just half or usually 12 days in that cycle. So that's a bit of the difference. It's not so much what we're talking about today, but just to clarify that. So we're talking about risks, and womb cancer, I've said, is usually for a woman who has been unintentionally exposed to estrogen alone, because you shouldn't have estrogen alone if you still have your womb. Okay. So the next risk, of course, is the risk of heart disease, which I'd already touched on a little bit in talking about the benefits. And that's why I say context is so important, because the facts are, the science is that if it started early on within, the menopause symptoms or the perimenopause symptoms start setting in, then you don't have that increased risk of heart problems, heart attack, and strokes. That risk is highest when HRT started late in a woman's menopause experience, commonly after the age of 60. So as the age of 60 sets in and, HRT use begins at that stage, then we find that there is a greater risk of heart disease. So the possible increase when combined HRT is started in older women above the age of 60, or in a woman who has pre-existing heart disease. Those are areas where we need to be cautious. And in terms of the important thing, of course, is monitoring, because even if there is that risk, but the benefits of taking HRT may be considered to outweigh the risk, because some women can get very, very distressing menopause symptoms. Then what to do would be look at starting the drug with the safest option possible, the lowest possible dose, and of course, frequent monitoring. But remember what I said about tailored individual approach. It is not one size fits all. You can't say, oh, because my friend is taking X dose of whatever, so I'm going to have the same dose of Everwell or whatever it is. It's got to be tailored, because you probably have different health backgrounds. Even in the same family, you may find that you're taking different doses or different strengths or different preparations. Tailored approach is so important. Right, so where are we? We're at heart disease. Blood clots. Let's talk about blood clots, because that's something else that you probably hear. Oh, HRT causes blood clots. So there is an increased risk of developing a blood clot, that is the blood clotting within the vessels. And that risk is greatest, that when you're taking HRT, that risk is greatest within the first 12 months of using the medication. So it's really important to be aware of that, particularly for women who are at risk of developing blood clots, who've had blood clots in the past, who have particular blood conditions that make them at higher risk of developing blood clots. One thing to say, because again, it's important to have context. One thing to say is this is a good place where alternative formulations are important. There's still a lot of research being done in terms of the safety of different forms of HRT, because you will know probably that we have oral HRT, we have that's tablets, that we have transdermal. So those are methods, HRT forms that you can apply through the skin, and they include things like patches or creams, gels. Of course, there are things like pessaries or rings that can be inserted into the vagina and so on. So there's so many different forms. But what we found from studies is that when HRT is given via the skin, it tends to have a lower, reduced risk of developing blood clots or causing blood clots compared to when it is taken by mouth. So again, context is important. Having a conversation with your prescriber is important so that we're looking at different things. What exactly is your risk of developing blood clots? Because some people might just hear, oh, HRT causes blood clots, and run away with that narrative. It does cause blood clots, I agree. But it's also good to examine closely to what degree, because guess what? Being pregnant increases your risk of having blood clots, even up to the point of 6 weeks after having the baby. A woman who's just had a baby is still at a high risk of developing blood clots. But you also want to put into context and determine what is another woman's individual risk of developing blood clots. Does she have a family history of a specific condition? Does she have that particular condition? Is she overweight? Does she smoke? All those different things will help us to narrow down how much of a risk before we say yes or no to HRT. So what am I saying? Tailored individual conversation. So we've talked about womb cancer, we've talked about blood clots, we've talked about heart disease. Let's go to breast cancer. So I'm going to get my I have a lot of graphics here, so let me just go through them and make sure I might have covered many of them already. Okay, so we've talked about HRTs. HRT for everyone. Healthcare professionals are advised to only prescribe HRT for the relief of postmenopausal symptoms that adversely affect the quality of life, and to regularly review patients to ensure that it is used for the shortest time and at the lowest dose. So we've talked about this already. I said this at the beginning, that not everybody needs to have HRT. It is meant for specific indications. So you don't have to have it. You don't have to worry about it if you don't need to have it. Okay. So let us see what's the next point. Okay. So the risk of getting breast cancer. First, let's talk about the risk of getting breast cancer. It is different for all of us. It's based on different things. Okay. Our family history, how old we are. Do we smoke? Do we take alcohol? What is our weight? How active or sedentary are we? Whether or not we've had children. Having children at a younger age and breastfeeding is known to lower the risk of developing breast cancer, while not having children or having them later in life can increase the risk. So let us just start from there. First of all, those are the known risks of having breast cancer. So what does my next slide say? Okay, so now let's look at what is it exactly about HRT and cancer? If a woman has been using HRT for a long time, the increased risk of breast cancer means she has a higher chance of getting breast cancer compared to someone who has never used it or somebody who's just starting. What does that mean? All that means is that, yes, there is a slightly higher risk of getting breast cancer if you use HRT compared to somebody who's never used it or somebody who just started using it a couple of months ago. That's what that means, okay? And that is for a woman who's been using HRT for a long time. So if you're using it for a short time, a couple of months, it doesn't just automatically jack up your risks. So again, we're talking about context, okay? So The longer that you take HRT, the more that risk goes up. For somebody who is newer to HRT, the risk is smaller, okay? But we think it can start to go up. Some studies say after 12 months, some say after 3 years. Certainly after 5 years of using HRT, there is definitely a higher risk compared to somebody who has never used it or who just started using it a couple of months ago. Okay, stay with me. I'm going through each of these statements one by one because, again, I want us to keep an eye on the context. I want us to break down the points that you might have heard and really put them into context. Okay, so we're talking about the risks of HRT, and I talked about earlier about combined versus estrogen only HRT. And so what we have here, using HRT with estrogen alone causes little to no change in the breast cancer risk. Okay, so there is for example, in the United Kingdom, there is a baseline risk of developing breast cancer in the population. So women normally going about their business, nothing to do with HRT, there is a baseline risk of developing breast cancer. And I showed you the possible risk earlier in my first slide, actually, being overweight, alcohol, smoking, so on. So combined HRT, we've said, can increase that risk slightly, and it's higher. The risk is higher the longer you've been on combined HRT. Now we're talking about estrogen only HRT, so it's not combined. It causes a little, so the risk is not as high, okay, or no change to the breast cancer risk. So what studies have told us is that, and I'm going to show you a picture of this, I think I have one later. What studies have showed us is that when we're comparing the extra risk that taking HRT could cause a woman, if it is estrogen only, there's just a little increase in that risk or none at all. Different studies showed us different things, but it was leaning more towards the fact that estrogen only doesn't cause so much of a risk in terms of breast cancer as combined HRT. All right, let us look at, I'm just working my way through my statements. I make sure I don't miss anyone. We've done that one. Okay. All right. So just to summarize what we've just been saying, using HRT, whether it's combined or estrogen only, can increase the risk of breast cancer. But we said that there's a difference between combined and estrogen only. The longer you use HRT, the higher the risk. We've said that as well. And that risk starts to show after about 3 years of using HRT. This is also important to say that when you stop taking HRT, that extra risk gradually goes down, but it could last for 10 years or more, especially if you've used it for more than 5 years. So like I've been saying, I think context is really important, and I don't want to downplay the risk of breast cancer, and we're not going to be blasé and ignore. We're not going to be ignorant. We're going to look at the facts and what exactly are they saying to us. And each one of us has a different risk of breast cancer. And so we have to make that judgment with our specific risks, with our weight, with our lifestyle, our habits, with whether we're active and going to the gym regularly, with whether we're not really a gym person, we're overweight, with whether we've had kids, whether we had kids and we breastfed, all the sort of risks that I talked about at the beginning. These are the things that we used to have these conversations to identify a woman's risk. But the last bit the last line of this slide where it says, even when you stop taking HRT, it could take over 10 years before your risk comes back to the rest of the population, everybody else who didn't use HRT. So those are the kind of things that, you sit down and you speak to your doctor, you think about your symptoms with menopause. Look at, are there alternatives if you don't want to go down that route? Look at what can you do to mitigate those risks? Any changes to your lifestyle, like stop smoking, cut down on alcohol, any of those things that we can actually amend that could help to reduce our risks. What else do we have to say? Okay, so vaginal estrogen, this is estrogen only, but this is vaginal estrogen. It doesn't increase the chance of getting breast cancer in a woman who's never had cancer. We're not too sure. So it is for discussion, usually with a specialist like your cancer doctor, the oncologist, whether to use vaginal estrogen. I've come across patients who have had cancer and have had vaginal estrogen treatment, but the conversation has always been with the oncologist to look at what type of cancer that they had, whether it had to do with hormones, what are the other risk factors. So it's not an individual, it's not a general conversation. It's one that's tailored to an individual's risk factors. So important to say that. Okay, no strong evidence that HRT increases the risk of breast cancer diagnosis for women with a family history or high risk benign breast condition. And it says what I've been sort of going on and on over again, the risk from HRT depends on each woman's personal risk level. So going back to, if you were here at the beginning where I talked about my own, sort of perimenopause journey and my own questioning whether I was going to use HRT. So this was really important to me. Excuse me, that there was no strong evidence that taking HRT increases my risk of breast cancer, given that I have a family history, in fact, a strong, close family history of breast cancer. So that kind of information is useful, which, I have to sit down with my doctor to sort of look at that and then think, okay, what are the other things that could put me at risk of breast cancer and how can I deal with them? And is it safe for me to use HRT? And then HRT is usually not recommended if a woman has a high risk of breast cancer, except for women who have the BRCA1 or BRCA2 gene mutations who have already had their ovaries removed to prevent cancer. So we wouldn't usually recommend if we think that you're at a high risk, unless it's somebody with the BRCA1 or BRCA2 genes who've had their ovaries removed to prevent cancer. And for those specific groups, HRT can be used to manage their symptoms until they're 50, and that will not increase their risk of breast cancer. But after the age of 50, okay, lifestyle changes and non-hormonal treatments are usually recommended. So again, conversation. It is not a one cap fits all, right? So if somebody says to me, oh, is it okay for me to use HRT? I've got this, that, or the other. I would be so interested in having a lot of background information. And that is why I usually just recommend people to, sit down and have a conversation with your own doctor. Okay, so let us have a look at this. I know if you're live, you might be struggling to see this. But let me just describe what it is. And I wish I could have gotten it a bit bigger, but this is sort of an overview in terms of the risk of breast cancer. So if you can see on the 4 different charts, there's different green dots. The different green dots in each chart are 1,000 women. Okay. You might also be able to see colored dots inside each of the charts. Perhaps you're able to see that. Okay. So the green dots are women, 1,000 women being, studied, while the colored dots, whether it's pink, red, purple, or whatever, refer to those who develop breast cancer. Okay, now, so it's all scattered. You can't really, I don't know if you can tell whether there's any difference from one chart to the other, but I'm going to go through each of them one after the other. What I want you to be aware of is the one on the left, the very first chart on the left, refers to the general risk of breast cancer for a woman over the age of 50 in the United Kingdom. So that's one thing I'd love you to be aware of. I hope you can see it properly. Let me change the view. Okay, I've changed the view so that hopefully I'm not in the way of the image. So the very first one, right, refers to or is demonstrating 1,000 women over the age of 50 and telling us how many of them will develop breast cancer based on the studies that we have. Okay, the number is about 23. The rest of the charts, the remaining 3 charts, give us different scenarios. One with women who are on HRT over the age of 50. The next one with women who drink alcohol, taking 2 or more units of alcohol daily. And the last one on my right is women whose BMI is equal to or greater than 30, so they are obese. Okay, I don't know if you can make out any differences just sort of looking at this chart, because again, it's context. And that's why I think this conversation is important. It's context. So let me take you out of your misery and let us dive into the charts one properly, one by one. So this is the one I call general. So this is the current risk. This is the one that changes from one to the other. No, this is not what I need now. Let's go. Yes, this is the one I need now. So this is the general, I call it general. So if you just take a snapshot of 1,000 women in the United Kingdom over the age of 50, the risk of developing breast cancer from studies is 23. So 23 out of those 1,000 women over the age of 50 will develop breast cancer. Okay. Now, let's look at the next one. And I think this is really interesting because this is women who drink 2 or more units of alcohol daily. And the risk has gone up. So the reason I put this out is there are 28 women who develop breast cancer when you look at a picture of 1,000 of women who are drinking 2 or more units of alcohol daily. In other words, taking this amount of alcohol daily provides a higher risk to women generally in the population. So that's a risk because of taking too much alcohol or taking that amount of alcohol, 2 or more units daily, increases the risk of breast cancer. We've not brought in HRT into the conversation. This is just for a woman who decides that she's going to drink 2 or more units of alcohol, she increases her risk of breast cancer higher than the general population. Let's look at the next one, which is a woman who is obese with a BMI that is equal to or greater than 30. And if you're looking at the dots, and the dots are nicely arranged at the bottom, you'll see that the number has gone up to 47. So we started at 23, which is the general population. But now, when you look at women whose weight or whose BMI, is equal to or bigger than 30, the risk jumps up. So being overweight contributes such a huge, is a big contributory factor. Is that the best way to put it? So being overweight is a big risk factor for developing breast cancer. And lastly, what about being on HRT? The number is 27. So if you're putting this in context, so what this means is that compared to the general population, if a woman is on HRT, you have 4 more likely to develop breast cancer while they're on HRT. So you have this group of women, 1,000 of them on HRT, 27 of them likely to develop breast cancer, compared to just any woman in a group of 1,000, no special risks, nothing specific, nothing different. It's just a woman on the street who has a risk of 23 out of 1,000 women. So let's go back to the main picture, which is this one. And I'm sorry I can't expand it, but on the left, you have the general risk, 23 women scattered in that 1,000 of the general population, compared to women on HRT. It's 4 more because that's 27. So 27 will develop breast cancer if they were in that group of 1,000 women on HRT. But if you had 1,000 women who were taking alcohol, taking 2 or more units of alcohol per day, that risk is 28. So that's about 5 more than the general population and nearly the same as if they were taking HRT. So taking HRT, think about it, on one hand, and the alcohol, 2 units or more, the risk of breast cancer almost the same, almost comparative. But the risk is even outweighed by being overweight. So if you look at the very last picture, the very last chart, where you have this 1,000 women whose BMI is equal to or greater than 30, 47 of them developing breast cancer. So nearly double that of those on HRT. So context. Let me just take us back and just remind us of the key points I wanted us to take away with today, or to go away with today. That tailored care is important. When you're talking about HRT, don't just run away with the narrative, because in the press or in social media, people might just write one, two or three words and say, oh, HRT causes breast cancer. But context is important. It's good to have a conversation with your doctor, not just about what data is available, but looking at your specific risks to be able to make that judgment and make the decision as to whether it is suitable for you or not. And of course, there are HRT alternatives. And of course, part of what your doctor will speak to you about before or in addition to having that HRT conversation is about lifestyle changes, because I know a number of women who have had HRT symptoms, but by making one switch here or the other, stop smoking or cutting down on alcohol, or just lifting weights and losing weight, losing body weight while lifting weights to support their bones, actually helped to manage their menopause symptoms. Sometimes it might just be lifestyle changes, but if you have that conversation and agree that HRT is the route for you to go, then please be empowered with the information that you need to be able to make that judgment. Is it the right drug for me based on your own family history, your own medical history, other medications that you're taking? As usual, we're here. Please ask questions. Feel free to send them via the email health information service. Please share this video with a friend. Give it a like. I completely forgot to say that. As usual, I usually forget. But yeah, give it a like. Share it with a friend. It would be much, much appreciated. If you're watching on the replay, let me know what you think. Let me know what your challenges are around HRT, what questions that you have around HRT. I've got a few more people who popped in and answered the poll or responded to the poll. Thank you so much. It looks like the risk of side effects is the biggest. That's so we've got 4 votes on the poll, which thank you to everyone. And everybody's just gone for risk of side effects, which I completely appreciate. And my response to that will be, have that conversation. Don't be afraid to have that conversation. Nobody wants to hide anything from you. Those are valid concerns. I'm a doctor. I had those concerns even with all my training. I wanted to sit down and say, right, how does all this apply to me? How do I make this judgment? The useful things to remember are that when we're prescribing HRT, the most common thing to do is to start with the smallest dose and increase it as you need it. But if the smallest dose is fine and controls your symptoms, then stay on it. When your symptoms are controlled, then you can come off it. We don't want you to stay on HRT forever and ever, only as long as you need it, with regular monitoring, breast examinations, your cervical smears if you're still having them, blood pressure checks, everything that looks at your physical and mental health and well-being. I think I'm going to stop it here. Thank you so much to Simone for her questions and comments, contributions. I very much appreciate that. And thank you as you watch the replay for any additional thoughts, comments, or questions you're going to put in. Please go and check out other videos that I've got on the channel. And yeah, I'll see you again soon. Have a very good week ahead, and talk to you soon. Bye-bye, everybody.
Hi, I'm Dr. Sylvia. I'm so excited you're here. In this video, you'll get excellent health tips that will make a real difference. But that's not all. I also create personalized guides, tools, and plans tailored to your specific needs. These resources will help you reach your goals faster and more effectively. Don't miss out on your free copies. Check out the links in the description box below. Before you watch this video, please like and subscribe to the channel so we can continue this health journey together. So, let's get started. I'll see you in the rest of the video.